for the first part, we're just going to have a quick look at what we mean by chemotherapy and what the principle of chemotherapy is. So a definition. Basically, when we talk about chemotherapy, what we mean is treating disease using chemicals, but those chemicals will have a selective effect on the organism causing the disease. So if it's an infection, on the microorganism, or if it's a cancer, on the tumor cells, the cancer cells themselves. In other words, the whole principle behind chemotherapy is that you can use chemicals which are selectively toxic, which have an effect on the cells that you want to kill and the ones that are causing the problem, but not on the healthy cells. And it's a principle which has been around for a very long time and was first introduced probably by the scientist Paul Ehrlich, who also coined the term the magic bullet, which went on to become a very evocative phrase. That's just a poster from a film that was made of the scientist and his work. But essentially, chemotherapy is about really looking for that elusive magic bullet, a substance which is going to target specifically the disease-causing organisms. And in antimicrobial therapy, of course, we've had some fantastic success in exactly that, in finding magic bullets that will target particular infectious organisms. In cancer chemotherapy, I suppose you could say we're still looking for the magic bullet that will be selectively toxic to cancer cells alone, but we're certainly getting a lot closer, and as you'll see when we talk about cancer chemotherapy, the selective targeting of cancer cells is becoming more and more of a reality. So I've just included this rather nice timeline. It came from Nature Reviews of Cancer, and I don't include it because I expect you to learn it, obviously, but it's interesting in that if you just want to cast your eyes over it, this is supposed to be a high resolution image, but you can see it's rather fuzzy and muzzy, but you can just make out what it's saying. But if you look along the timeline, you can see the development from the early days, pre-1900s, when the idea was just forming, and this is when Ehrlich was doing his work, that the interaction between cells and toxins and microorganisms and cells of the immune system or antibodies was to do with chemical interactions between specific sites. So it started to be recognized that specific molecular targets on substances could be responsible for the way that they interact with each other, or whether they're able to cause disease, whether they're able to protect against disease, and so on. And this is really where the lock and key theory of pharmacological action that we talked about in the first few sessions of this course came from, that in order for one substance to do something to another substance or to a cell, it looks like that substance has to have a specific molecular fingerprint, if you like, and a specific pattern that can fit into the other cell or substance. And this idea has been developed through the years, so we've got down to closer and closer molecular targeting of treatments. And the term magic bullet actually was one that Paul Ehrlich gave to antibodies. He called them magic bullets because that's exactly what they do. Antibodies are produced against a specific target, and they basically fly around looking for that target. And when they find it, they lock onto it and allow it to be destroyed. But they don't destroy anything else. So that has been what science has been looking for in the treatment of both infection and cancer. And you can see in these various boxes various landmark discoveries in this area, and towards this end now becoming sort of contemporary discoveries, you can see that what we're seeing here is using immunotargeting biological agents to target to specifically identified targets on cancer cells or on infectious organisms. But you can see up this end there's a lot of cancer targeting drugs being produced. So that's an interesting history of how chemotherapy has gradually developed from an early idea to now some fairly sophisticated treatments. And we're going to look at some of them. So with antimicrobials we need to have a few definitions straight. So antimicrobial is a general term which basically means any drug which acts on microbes, either to kill them or to stop their growth. Now microbes would be basically bacteria, they could be fungi, they could be viruses, they could be protozoans, They could be a number of different organisms. The term antimicrobial is a very broad term. It just means any drug that acts on any kind of microbe. Doesn't matter what sort of group it belongs to. Terms like antibacterial are more specific. In other words, obviously, this is a drug which acts against bacteria to either kill or stop them growing. And we've got also, of course, terms like antifungal, antiviral, antihelminthic, which would be against worms, antiprotozoal, which would be against protozoans. So we have all those more specific terms. And then there's this one here, antibiotic, which sometimes confuses people. Antibiotic is essentially a substance specifically which is produced by another microorganism. So it's a substance which has actually been naturally produced by some other microorganism, like a mold or some other form of fungus, for example, and that substance has antibacterial or even broader antimicrobial properties. So the term antibiotic probably wouldn't be appropriate to use a great deal anymore, as you'll see when we come to look into the antimicrobials a little bit more, because whereas our first antibacterials in particular were antibiotics because we got them from other substances which produced them. We basically cooked up lots of molds and got them producing the antibacterial substances, and we then purified that, we collected that and used it against bacteria for ourselves. So those were truly antibiotics. But now the large majority of the antibacterials that we would use clinically are synthetic drugs. They are no longer produced, although some of them are, penicillins, some of them are still produced by molds and things, but a lot of them are synthetic derivatives of those antibiotics. Okay, I think that's all we need to say. Apart from this, I thought this was a rather good quote, that antimicrobial therapy is getting a bad rap of late because we have a huge and developing problem in the area of fighting infectious disease, and that is the resistance of microbes to our commonly used and most effective antimicrobials. And that is a big worry, and we're going to talk about it more. But in all of that, the developing resistance should focus our minds on how much we have come to rely on antimicrobial therapy and on how much it has done for the human race. The increase in life expectancy is quoted here as about 10 years in 20-30 years of antimicrobial therapy use. We have come to take it completely for granted that we have pretty much conquered most of the infectious illnesses that caused widespread mortality. And we're now going to have to rethink that, and we're now going to have to come up with some better things, because we're losing our magic bullets in the antimicrobial area as a result of developing resistance. And it is a huge advantage that we have had from these magic bullets that we are now gradually losing, and we need to do something about that. In comparison, while we have put a huge amount of research and there have been huge strides forward in cancer chemotherapy also, and many cancers have moved from being incurable, very short prognosis from diagnosis of maybe a couple of years, to being, if not curable, allowing a normal life expectancy. Many are still to be conquered, but given the nature of cancers, prevalence increases with increasing age. They tend to be, by and large, a disease of older age. I know there are exceptions, but by and large a disease of older age, compared with the fact that infectious disease can hit anybody at any time of life. Without effective antimicrobial drugs, we are constantly at risk of infection which can overwhelm and kill us, particularly post-surgical. So you can see that the loss of effective antimicrobial therapy will affect many more people at many more stages of their life. So the difference in life expectancy changes when you have effective ways to combat infectious disease versus effective ways to combat cancers is quite marked. So we're going to talk about both of those, but I hope I've instilled in you, if you didn't have it, a great respect for our antimicrobial therapy and a sense of urgency, maybe, in the realm of antimicrobial research.